Welcome to UOA on Demand. My name is Dr. Tony George. I'm an interventional pain physiatrist, and I'm here today with my colleague, Dr. Pavli Demian. And today we're going to talk about Botox for migraines. So my first question to you, Dr. Demian, is tell me a little bit about migraines.
So migraines are a type of headache. They're not just any kind of headache. They are actually typically associated with things called auras, which is a sensation or kind of a visual disturbance, if you will, before the severe headache commences. They're kind of refractory to typical treatments. And they're very challenging to treat for physicians. Typically, the diagnosis of migraines is made by a neurologist, and it involves the initiation of several treatments, including oral medications, activity modifications. There are injectable options, but some patients fail those treatments, and for those patients, we consider Botox for their migraines.
So you consider Botox for migraines after they've failed some of the first-line therapies, and they've usually seen a neurologist already. And when they have failed those preliminary treatments and they're still dealing with this pain, they come to you for Botox treatments. Now, we're all very familiar with Botox for cosmetic reasons. And us being physiatrists, we have also in our training done Botox for function for some of our patients that have either had stroke and they have upper motor tone, or patients with cerebral palsy. We have done Botox for those patients as well. But what makes Botox different for migraines? Is it the same cocktail, or is it different when you do it for migraines?
So a little bit about Botox. Botox is the brand name of onabotulinum toxin A, which is essentially botulinum toxin. It's a toxin that's made by that's naturally found. It can be very dangerous, but it's been distilled into very small doses, and we can administer it to our patients who need it. Typically, there are two types of botulinum toxin, onabotulinum toxin A and onabotulinum toxin B. They act in different ways to weaken and paralyze muscles, depending on the dose. So essentially, what Botox is, which has kind of become the generalized term for botulinum toxin, it's an injectable kind of medication that we inject into muscles to decrease their tone and decrease their spasm. And it's been shown to help people's migraines and headaches when put into the muscles of the face, neck, and head.
So we know that botulinum toxin or Botox in large doses can be dangerous. But these are injected in much smaller doses, as you mentioned. So to what extent do you dilute it? Like how small of a dose are we talking about?
So the dose is so small that we can't actually measure it regularly. There's no measurement unit. It's just called a unit. So typically, when people have Botox for cosmetic purposes, there could be anywhere from 1 to 5 units injected at each site. For Botox for migraines, we typically use 155 units for the entirety of the upper neck, the traps, the head, and the face. And these are effective doses for treatment of migraines, but small enough that they very rarely cause any harm or adverse reaction.
Got it. So one of my patients came and asked me, Doc, if you inject Botox for my migraines, what part of my face am I expecting these injections to go into? So are we thinking about muscles on the front of your forehead, or could you be specific in terms of the location where, if a patient were to come and see you, where are they expecting it to be injected?
So typically we inject at the upper traps, the base of the skull, the back of the head, the sides of the head, and the forehead. Those are done symmetrically, and they're done using a very tiny 30 gauge needle, which is even smaller than a small sewing needle. And that's typically where we inject it. There is a protocol that was FDA approved that involves those areas. However, we typically have 45 units extra that could be added to patients' more problematic areas. For example, if patients get really bad migraines in the back of their head, we can consider adding extra doses there. That would be, of course, off-label, but has been shown to be helpful for patients.
Now, how long does this procedure typically take?
So typically the procedure takes about 5 to 10 minutes. That does not include prep. And there are multiple safeguards within the prep to make sure that it is that everything is done appropriately. We can expect the results to kick in within 10 to 14 days and to last for about 2.5 to 3 months. Typically, we require repeating the procedure every 3 to 4 months, depending on the patient's needs. However, it's very difficult to get it approved. That is a very expensive medication. It's difficult to get it approved to be done more frequently than every 3 months. The other thing is we don't want to over-inject Botox because your body can become resistant to it. When appropriate doses are used, that happens less and less so.
Got it. So we, as interventionals, we talk to our patients about risks and benefits and complications. And one thing I know about patients that get migraines, they generally tend to be, we see migraines occurring at least 2 to 3 times more often in women, and most of them tend to be in childbearing age. So what do we worry about in terms of some of the risk complications? Who are candidates or who are not candidates? Who probably needs to wait? So just some of the risks and that patients need to be aware of, and who should probably avoid Botox for migraines.
So typically our patients who are pregnant or may be pregnant, also patients who are breastfeeding, they're not candidates. And this is done out of an abundance of safety. Additionally, patients who are very elderly or may have severe respiratory issues and require or who have kind of frequent hospitalizations due to respiratory or breathing problems, there are patients who we would maybe consider other options for before considering Botox. However, with those patients, it comes down to a discussion with your doctor and their pulmonary specialist, looking at the risks and benefits of the procedure, just like with any medical procedure.
So as an interventional, as a PM&R specialist, what makes you and I ideal to do these Botox injections, or better specialists in addressing patients through use of Botox?
So, multiple reasons to kind of seek interventional physiatry. Typically, physiatrists are trained and are required to have pediatric and stroke rehab within their training. And in stroke rehab and pediatric rehabs, where you mentioned before, Dr. George, we get a lot of training with patients who have significant muscle spasm, known as upper motor neuron syndrome, as a result of a stroke or a brain injury, or as a result of a musculoskeletal condition, a neuromusculoskeletal condition called cerebral palsy in children. And in those patients, much higher doses are used than in the doses for Botox, and they're still deemed safe. Additionally, I think a physiatrist is well equipped to not just determine who the procedures are for, but also to determine which patients maybe would benefit some other intervention that is not Botox. We're able to kind of see if there's other causes of headache. Not all headache is migraine, and not all migraines are or require Botox. So with all these tools in our kit, we can maybe evaluate and see if the neck is causing persistent headaches that may mimic and may be identical to a migraine.
Thank you, Dr. Demian, for that wonderful overview of Botox for migraines. Several of our patients at UOA do get Botox treatments for migraine and benefit tremendously from that treatment. If you or any of your family or friends have migraines and have not been successful with getting that controlled, I would encourage you to see one of our interventional physiatrists here, Dr. Pavli Demian and myself, to address migraine headaches with Botox and see if you're a candidate for that. Thank you once again, and have a wonderful evening.